Hi everyone, this is Dr. Khokhar at Houston Lasik Eye. I'm going to describe how I implant an Evo ICL for the average Joe or Jane. ICL stands for implantable Collamer lens, and it's a biocompatible implantable contact lens of sorts. I use it to correct moderate and large amounts of nearsightedness with or without astigmatism. And I can do this without permanently changing the shape of your eye as is done with LASIK. You're completely relaxed and not feeling any pain. I've already entered the eye here using a 1mm microblade and put additional numbing medicine, followed by a temporary filler material. A few more necessary entry points are made before I start to insert the ICL. Before starting the surgery, I already folded up the ICL like a burrito into an injector. And that's what allows me to get it through this micro incision, which is only 2.8 millimeters wide. I insert it slowly, making sure I have full control, and as it enters the eye, it slowly starts to unfold. There we go. Now I put a little more filler material in. It's time for me to spend a few minutes tucking these 4 foot plates on the end of the lens behind the iris, which is the colored part of the eye. That's the second one. That's the third one. And that's the fourth one. I spent a few minutes rinsing out that filler material I put in earlier. Bubbles are often part of eye surgery. I'm removing some of the large bubbles here, and the small bubbles will just go away in a few hours. No stitches are needed, and we can close the entry sites just by flushing some water into them. This patient was extremely happy and was seeing 20/20 the next day for the first time in her life. Thank you for your attention, and leave some questions or comments below.